Oh, hell.
Here they are using internal rotation and abduction of the shoulder, where they are engaging the scapular muscles and the latissimus dorsi for resistant movement quality. Then they use their right and left elbow flexion with lateral flexion of the trunk or engagement of the external obliques. Then they are using their forearm supination simultaneously with wrist flexion, which is when they're flicking downwards, then left forearm pronation and wrist adduction, which is the second flick, simultaneously with engagement of the sternocleidomastoid and scalene muscles for the left rotation of the neck. Then they maintain flexion of the left wrist and supination of the right hand with wrist flexion as well, protraction using sternocleidomastoid and scalene muscles again, then retraction of the neck using the trapezius and splenius cervix. Then the right forearm pronation, wrist flexion, shoulder flexion to extension, neck extension to neutral neck position while body rolling, which is when they're going through the cervical, thoracic, and lumbar spine, utilizing erector spinae muscles for stabilization, inflection, and extension of the spine for fluid movement, rectus abdominis, aiding in flexing lumbar spine, and wave-like movement, iliopsoas for pelvic and spine stabilization in the lower extremity. We can see them demonstrating that here. From here, as they lift up their right leg, they engage their iliopsoas muscle along with the gluteus maximus and quadricep, which includes the vastus medialis, vastus intermedialis, rectus femoris, and vastus lateralis muscles to bring the leg to 90 degrees. While this is happening, the deltoids and trapezius work together in the elevation of the scapulas. They then roll their hands using their forearm flexors. From here, they use their internal and external obliques to help rotate their body into a transverse plane.
Once again, here they use their forearm flexors while flipping the wrist down and rolling through the cervical, thoracic, and lumbar spine. They then contract the biceps as they move medially towards the center of the body. The right leg adducts using the adductor longus, brevis, magnus, and gracilis to bring the leg medially. The obliques are used to rotate at the spine, initiating at the gluteus medius and maximus. The upper body is using the trapezius, deltoids, and rhomboids in the adduction and eversion of the scapula as they throw their arms out. The leg abducts while the back is moving in the erector spinae. The sternocleidomastoids are stretched as they elongate their neck, and as the leg adducts, it goes back to neutral. There is an extension of the hip through the gluteus maximus and iliopsoas, which stabilizes their lower extremity. The trapezius, deltoids, biceps, and rhomboids help adduct the scapula as the spine goes from rotation to a neutral spine where they are in the frontal plane. They collapse to the ground using their quadriceps and roll through the extensor digitorum longus and extensor hallucis longus, placing their arms on the ground to crawl on the floor and using the flexor retinaculum.
The dancers get up from the ground using the carpals and metacarpals as supports to push off the floor. The dancers make individual arm choices that involve flexion of the elbows and wrists and utilize the mobility of the elbow joint and the glenohumeral joint. There's slight rotation in the trunk, which utilizes the transverse plane. The right dancer's neck is rotated by the scalenes and sternocleidomastoid, and the left dancer's neck is laterally flexed by the scalenes and splenius. The dancers then rotate the hands at the radiocarpal joint and go into ulnar deviation. They experience internal rotation of the right leg with gluteus medius and slight external rotation of the left leg through the use of pigogocues and gluteus maximus. Both knees are flexed by the hamstring group, which is the semitendinosus, semimembranosus, and biceps femoris. The thoracic spine is rotated by the external and internal obliques and the latissimus dorsi. During this arm movement, the scapula retract or adduct with the use of the entire trapezius, levator scapulae, rhomboids, and deltoids. The thoracic spine is rotated even more using the same muscles and utilizing the transverse plane. The pelvis drops quickly, bringing the knees into flexion. This involves the hamstring group and the external and internal obliques. This throwing arm movement involves adduction of the arms. Other movements occurring in the body are flexion of the elbow, hip, knee, wrist, and ankle. Muscle groups involved in these movements include the quad group, anterior muscles of the forearm, hamstring group, and anterior muscles of the lower leg or shank. This movement utilizes all three planes of motion. The pelvis is moving through the transverse plane, and the arms move through the frontal and sagittal planes. These few steps would not be possible without the stable nature of the leg, shank, and ankle. The long bones like the humerus, tibia, and fibula provide structural support. The tarsals and metatarsals provide stability in the forefoot and midfoot, and short bones like the talus stabilize the hindfoot and allow for range of motion in the ankle.
Thank you so much for watching our choreokinesiology project. Choreography credits to Lauren J. Kim and Ali Chu from Kava Modern. Bye!